The Quality and Safety Education for Nurses, or QSEN initiative, was started to prepare nurses with the competencies necessary to continuously improve the quality and safety of the healthcare systems in which they work. Over a decade ago, the Institute of Medicine released reports that got the healthcare world's attention on the importance of improving healthcare outcomes. These reports made it clear that there needed to be a change in nursing care to better serve patients in the healthcare environment. Despite many efforts for improvement, it was reported that the majority of hospitals have showed little progress in improving quality and safety. For example, although we know that zero central line infections should be a reality in hospitals, thousands of infections are still reported each year. So as a result, in 2005, nursing leaders responded to the need to improve the quality of healthcare by getting together and forming the Quality and Safety Education for Nurses, or QSEN, was born. This initiative, which is funded by the Robert Wood Johnson Foundation, is made up of 6 competencies, which together teach future nurses ways to improve quality of care in their field. The mission of QSEN is to assure that nurses have the knowledge, skills, and attitudes necessary to continuously improve the quality and safety of the healthcare systems in which they work. So what are these 6 competencies? They include patient-centered care, safety, evidence-based practice, quality improvement, teamwork and collaboration, and informatics. Now let's look at these a little closer and go over why they may be so important to know. Let's start with patient-centered care.
What's taking the nurse so long?
They'll be here, Mom. We literally just hit the call button.
No, you didn't, dear.
Yes, I did.
Hit it again.
No, Mom.
Yes, dear, hit it again.
OMG, it says it's already sent the call.
OMG, where? No, it doesn't. Hit it again.
Mom, you wouldn't even be able to see it from there. Ugh, can you please not embarrass me like this when the nurse gets here?
Me embarrassing? Why, I'd never. Just hit it again.
Mom!
Hey there, my name is Jack, and I'm going to be your nurse for today.
It's about time, Sonny. It's been 84 years.
Okay, so how are you feeling today? You can actually just go ahead and sit back down now.
Everything is perfect. Can you just get me my food and cup of water, please?
What do you mean everything is perfect? Tell them how you can't sleep.
Okay, yeah, I've been having some trouble sleeping lately. The medications don't seem to be working all too well.
And why are the lights so bright in here? How can anyone sleep with all these lights coming in from the different rooms?
I'm really sorry to hear that. There are definitely a few things I can try to do for you to help you sleep. I can dim these lights for you in here and close the blinds so no more lighting can get in. And I can talk to the doctor and perhaps switching up the medications for you. Might I also suggest that you bring any personal belongings, anything else from home that would normally aid you to sleep? Do you usually read, maybe, or have your pillows a certain way?
She listens to music.
Mom!
Actually, music is a great idea. You can certainly play that here as long as it's not too loud, of course.
Really? OMG, that would so help. Even Celine Dion?
Are you kidding me? Especially Celine Dion.
Great, thank you so much. I really feel like you provided great patient-centered care.
Well, glad to hear it. If you need anything else, don't hesitate to hit the call light.
Ha! Too bad it doesn't work. Hit it and show 'em, dear.
It does too work, Mom.
Just hit it again.
I told you not to embarrass me in front of the nurse.
Haha, okay, yeah, I'll be going now. I better be getting Grammy for this one.
What did you say, Sonny?
Nothing, okay, bye now.
Call me. I'll call you.
QSEN defines patient-centered care as recognition of the patient or designee as the source of control and partner in providing compassionate, coordinated care based on respect for patients' preferences, values, and needs. This means that you as a nurse need to listen to the patient and realize that they are individuals who come from different backgrounds and cultures, so you need to do your best to cater to their unique needs. From the video, Nurse Jack asked his patient what she did normally at home that helped her sleep, and demonstrated active listening. By doing this, he gave control to the patient and her family in their own care, and in the end came to a mutual solution. Nurses are essentially the only people patients and their families can really reach out to in what can be a scary and confusing time in their lives. So be an advocate for them and reassure them that you are on their side. So the key message from QSEN here is to realize that the patient and family should be in a partner relationship with their healthcare provider and should be given relevant information, resources, and access to fully engage the healthcare experience as they choose. Safety. Safety is defined by QSEN as the minimization of risk of harm to patients and providers through both system effectiveness and individual performance. Easily one of the most important competencies, patient and provider safety is paramount and should never be taken lightly. The QSEN project places a significant emphasis on helping students understand the complexity of care delivery systems when it relates to safety. The QSEN competency for safety lists the knowledge, skills, and attitudes students need to know to practice safe care. Now let's look at evidence-based practice.
Hey, Forrest, there you are. I've been looking all over for you. Listen, can I speak to you about something kind of important?
Sure, Charge Nurse Jenny. I'm not in trouble, am I?
No, don't worry. For a new hire, you're doing great so far. I just wanted to talk to you about your patient in room 211. As you know, he has a history of falls, so I want you to make sure you implement fall precautions with him. Evidence has shown that by implementing these precautions, the number of falls has decreased immensely.
Oh, wow. I will be sure to remember that.
Good. Also, make sure you get in the habit of washing your hands before and after leaving patients' rooms. Evidence has also shown that by doing this, you decrease the chance of transmitting infection to both you and your patient.
Oh, I knew that, Charge Nurse Jenny. Bacteria's like a box of chocolates. You never know what you're gonna get.
Where'd you get those from?
Sorry, gotta run. Bye.
Don't run, Forrest. Don't run in the hallways.
Evidence has also shown that everyone likes shrimp, and shrimp should be on the menu every day.
Evidence-based practice. This is defined by QSEN as the integration of best current evidence with clinical expertise and patient family preferences and values for delivery of optimal healthcare. According to Dr. Kathleen Stevens, Professor and Director of Academic Center for Evidence-Based Practice and Improvement Science Research Network, the impact of evidence-based practice has been profound across nursing practice, education, and science. Over the past decade, nurses have been part of a movement that reflects more change than any 2 decades combined. Evidence-based practice is aimed at hardwiring current knowledge into common care decisions to improve care processes and patient outcomes. All of the healthcare practices we do now are practically done because of clinical evidence taken from up-to-date systematic research and statistics. This in turn ensures the best quality and safe care for the patient and their families. Quality improvement. QSEN defines this as the use of data to monitor the outcomes of care processes and improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. Many hospitals have quality improvement teams or committees that you as a nurse may be a part of one day. These committees construct quality improvement projects to better the care patients receive. Some seemingly small but very significant protocols have been implemented into hospitals to increase the quality in care as a result from some of these committees. One example is no pass zones. A healthcare provider or any hospital employee is not to walk past a call light or a patient in need without addressing the problem or situation. Another includes hourly rounding, in which healthcare providers are to check on their patients every hour. Even simple tasks such as these play an important role in the quality of care a patient receives. Teamwork and collaboration.
I need to help myself in bed, but I can't move. Where's that call light? Yeah, here we go.
Hey, how you doing? I'm Nurse Rocky.
Where my nurse at?
Oh, you mean Nurse Drago? Yeah, he actually was talking to the doctor on your behalf because you wanted your meds changed. So I'm covering for him because that's what teamwork is all about, working together.
Well, that's great and all, but who's gonna help me in bed?
Don't you worry, sir. I will take care of it. Yo, Adrian! Adrian!
Rocky!
Adrian! Yo, Adrian, come here.
Hi, sir. What's going on, Rocky?
Could you please assist me in helping Mr. Apollo up in bed?
Yes, of course. I would love to.
Well, I would appreciate that.
Okay, ready? 1, 2, 3, upsy daisy. Great form, Rocky, attaboy.
What? Did you guys hear that?
No.
Okay, well, anyways, you guys make a great team. High five.
Yeah.
Teamwork and collaboration is defined by QSEN as those who function effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision-making to achieve quality and safety. Not only is teamwork crucial between fellow nurses, but we also are a part of a much bigger healthcare experience for the patient and their families that involves doctors, pharmacists, technicians, dietitians, chaplains, therapists, and others. All of these groups work together as a team to serve as an integral part of patient care, in which can only be achieved through open communication and respect. Safe and effective patient care requires teamwork, collaboration, and communication among all team members. It is not about one main leader for all situations, but more about who has the necessary skills to provide the best and most appropriate care in the given situation. And lastly, we have informatics. This is defined by QSEN as the use of information and technology to communicate, manage knowledge, mitigate error, and support decision-making. Not enough praise can be given to technology and information, as it obviously plays an enormous and crucial part in healthcare. QSEN reiterates the need to educate future nurses on the importance of information and the proper use of technology in healthcare. And so it's clear that thanks to the QSEN initiative, nursing care has shown significant improvements in the past couple of decades. Patient care has never been as much of a priority as it is now, and thanks to the continuing improvements in nursing education, it can only get better.
I've been watching you.